Step 8, heal glands and organs. Did you ever want to slow aging and promote healing? This is what step 8 is all about. Now that you have built your ability to have great cell health, it's time to have all of those great cells work together and make your health span equal your lifespan. The best way to keep your cells working together is to make sure every cell in that organ or gland is being stimulated properly by certain different types of whole foods and herbs to turn on the right genes and turn off the wrong genes to slow the aging process and promote healing. This is why in step 8, we're going to focus all of our attention on slowing the aging process and healing the glands and organs involved with your ability to handle stress, because it is the stress handling mechanism that makes you age faster and decreases your healing. So let's talk about the glands and organs of our stress response. You have one organ and 3 glands involved in your ability to handle stress. The one organ involved is your liver, and it helps you get rid of toxins so that the hormones that the glands produce can actually work more effectively. The first gland is your thyroid gland, and it helps with your metabolism, among many other things. The second gland is called your adrenal glands, and these 2 glands sit on top of your kidneys, and their job is to decrease your inflammation and help control your blood sugar. The final gland that helps you with your stress response is different for men and women. If you are a woman, it is your ovaries, and your ovaries help balance your female sex hormones. If you are a man, it is your testes, and your testes' job, among other things, is to help balance your male sex hormones. This organ and these 3 glands must work together at their best so that you can age gracefully and heal properly, no matter what your age. So let's start by talking about how important an organ your liver is. Your liver is extremely important in your ability for your glands to heal and your organs to heal. You must be able to get rid of many different types of toxins, and your liver's job is to capture those toxins that are circulating in your blood and in other fluids and package them up so they can't hurt you. Then get rid of those toxins through your bowel movements. So you might be wondering where all those toxins come from. As a matter of fact, in medical terms, you have what is called your toxin load. And this picture tells the story on where all those toxins can come from. On the top of this picture, you see the first circle that is looking at the physical causes of your toxin load. And physical toxins can come from injury, can come from excess inflammation, and it actually can come from excess exercise. So if you are a distance runner or somebody who is really working really hard, actually too much when it comes to exercise, you actually increase your toxin load. Moving around to the right, the next circle is the nutritional toxin load. And so nutritional toxins can come in the form of preservatives, it can come in the form of additives in your food, it can come in the form of taking synthetic vitamins and minerals. There's many different things that will actually increase your toxin load from a nutritional point of view. On the bottom of this picture, you can see that the toxin load can also be increased by different chemicals. Xenobiotics are something that are found in different kinds of foods, in different kinds of really what's called off gases, off of different kinds of plastics and flame retardants. There is many different chemicals that we can find all throughout our environment. The second kind of chemical toxin loads are called organics. And these organics can be found in many different types of herbicides and pesticides, and they can also cause all kinds of problems with your hormone system. And then you could also have excessive hormones that are found in food, that are found in different types of plastics, that are found in many different things that you never even consider. But all of these different things are chemicals that could increase your toxic load. The final circle in this picture looks at the toxin load increase from different types of infections. And when you have an infection, you have both endotoxins, which means internal toxins, and you also have what's called exotoxins, which means that they're exterior toxins. And both different types of toxins, endotoxins and exotoxins, can come from different bacterial, fungal, or parasitic infections. So, as we'll learn a little bit later in the next step, that these infections can cause all kinds of increases in your toxin load that you never even considered before, but can lead to all kinds of problems with your ability to age gracefully and to heal effectively. Now that you understand a little bit more about your toxin load, you can see why your liver is so important when it comes to healing your glands and organs. Because if you don't have a really easy and effective way to get rid of these 4 different types of toxins and decrease your total toxin load, your ability to heal and to have better organs and glands is going to be severely compromised. So let's look at this illustration of liver detoxification. If you start on the left and you see that the toxins, the drugs, the pesticides, and the food additives, they'll come into the liver and they will undergo what's called phase 1 biotransformation. And when these toxins that are not that bad go through phase 1, they become water soluble, and then they are transmitted through the bile and through the urine and out the body. But if you have a nasty toxin that is really bad, phase 1, the toxic byproducts of phase 1 get sent to phase 2, and then the nastier toxins are then made less nasty, and then they become water soluble, and then they are then transferred out of the body through the bile and the urine. Think of phase 1 that it would be like getting your garbage ready to be packaged for pickup. And phase 2 is when the garbage is getting picked up and it's out at the street. And if it is not picked up, the toxins are collected in your body and make you sicker. So now that you understand about the liver detoxification process, let's start talking about the first of the glands that help you handle stress, and that is your thyroid gland. So let's talk about thyroid stress handling. So the thyroid gland produces 2 different hormones. One is called T3 and the other is called T4. And there is 20 times more T4 produced than T3. Really what happens is T4 gets converted to T3. The gland itself can decline from vitamin, mineral, and amino acid deficiencies, and metabolism can slow down with a low protein diet. And this leads to pitting of the skin, which is another name for cellulite. And if you have a low protein diet and low thyroid hormone production, then cellulite will develop more frequently. The most common symptoms associated with thyroid stress handling problems is when you feel sluggish, you're unable to regulate your body temperature correctly, you have uniform weight gain, in other words, you have weight gain all around your body, and depression. I like this illustration because it shows what I see all the time with women who come and see me in my office. I'm cold, tired, swollen, and depressed, but my doctor says that I have nothing to worry about because my TSH is normal. Yay! Which is totally what most people think. But what we're going to talk about next is how the most common problems that occur with the thyroid gland, the TSH stays normal, but the problem is still a real thing and is there. There has certainly been a boom of thyroid gland problems, and this has led to a lot of the issues that we're finding with thyroid stress handling. Thyroid problems are becoming more and more common all the time. And people are being told that they are fine, yet their symptoms are saying otherwise. Some conservative estimates predict that more than 12% of the population will have some kind of thyroid disease during their lifetime. And most thyroid problems are much more prevalent in women than men, but I have seen a huge increase in the amount of thyroid problems with men over the last 10 years. And the most common thyroid problem is something that's called hypothyroidism. In other words, the thyroid gland is getting tired and it is not working the way it should. Like we just discussed, the most common problem with the thyroid gland is called hypothyroidism. And there is basically 6 different patterns of hypothyroidism. And so let's describe each one of those right now. So the first pattern of hypothyroidism is called primary hypothyroidism. And this is the only one of the 6 that can be effectively treated with medication. And primary hypothyroidism occurs approximately 10% of the time. So what this means is that you have a 1 out of 10 chance that the medication that you have been put on for your hypothyroidism is actually going to do you much good. And this is true unless it is being caused by Hashimoto's disease. And Hashimoto's disease occurs when your thyroid gland is being attacked because it's an autoimmune disorder. So if your primary hypothyroidism is being caused by Hashimoto's, the medication won't work either. And primary hypothyroidism is diagnosed when your TSH is high. Your TSH stands for thyroid stimulating hormone. And thyroid stimulating hormone is produced by your pituitary gland, and your pituitary gland is basically shouting at your thyroid gland to work correctly. The second pattern of hypothyroidism is hypothyroidism secondary to pituitary hypofunction. What that means is that your pituitary gland is also become tired and is now not working the way it should. This is usually caused by chronic stress, which causes pituitary fatigue. TSH, or thyroid stimulating hormone, remains in normal limits or is usually just a little low. And so this is usually caused by 4 different things. It's caused by stress. It can be caused by postpartum depression, or when a woman has depression after childbirth. It can be caused by overuse of thyroid medications. So if you use thyroid medications when you don't need them, it can cause this hypothyroidism secondary to pituitary hypofunction. And then finally, there could be a loss of the feedback mechanism from the pituitary gland to the thyroid gland, and this can also lead to this kind of problem. The third pattern of hypothyroidism is thyroid underconversion. And what this means is that when you have too much cortisol, it decreases the conversion of T4 to T3. And T4 is the non-active form of thyroid hormone, and T3 is the active form of thyroid hormone. And this can also be caused by chronic inflammation or by chronic infection. And the TSH stays in normal limits. The fourth pattern of hypothyroidism is called thyroid hormone overconversion. And this occurs when too much T3 is converted. And this leads to T3 resistance in the cell membranes. So when you have too much T3, then the T3 receptors on the cell membranes start to say, you know what, I can't do this anymore, and get burnt out and become less reactive to the T3. This happens in the presence of too much testosterone. So when you have too much testosterone, which is commonly occurring in insulin resistance and PCOS, which is the acronym for polycystic ovarian syndrome, then you can have this pattern of hypothyroidism occur, and this is actually very common. The fifth pattern of hypothyroidism is thyroid binding globulin elevation. And this pattern commonly occurs with estrogen replacement therapy or oral contraceptive use. In estrogen dominance, too much of this thyroid binding globulin is created, leaving little or no room for thyroid hormone to be unbound and available for use with the cells. So any woman who is on estrogen replacement therapy, or any woman that is taking oral contraceptions, this is a very common type of hypothyroidism that occurs, and TSH remains in normal range. The final of the 6 patterns of hypothyroidism is called thyroid resistance. And this is another stress-related pattern caused by cortisol resistance. So any of the stress hormones that you can talk about, cortisol, thyroid hormone, every one of these different stress hormones, when there is too much of these hormones that are flowing through your body, the receptors on the cell membranes for these hormones just start to get tired and burnt out and don't work correctly. And in thyroid resistance, the TSH still remains within normal limits. So you might be wondering, why on earth are we having so many thyroid disorders that are occurring today that weren't here 20, 30, 40 years ago? And the main cause is it's the role of iodine deficiency. The most common reason for thyroid disorders is iodine deficiency, because this leads to the formation of goiters and hypothyroidism. Iodine is absolutely necessary for the production of thyroid hormones. T3 and T4 are made up of iodine molecules. So if you do not have enough iodine in your body, you cannot create thyroid hormone. The prevalence of goiters in some iodine depleted areas is as high as 80%. So in other words, 8 out of 10 people in a lot of areas start to have goiters because they do not have enough iodine in their food, in their soil. So thyroid hormone production is decimated when you do not have enough iodine. Goiters actually occur and is caused by a lack of iodine. And a goiter may be present with or without the autoimmune disease called Hashimoto's disease. The goiter can be slight or it can be quite visible. And it is important to provide the necessary vitamins and minerals to help the body fully utilize iodine. And these minerals are selenium, zinc, magnesium. All three of those minerals are extremely important to be with iodine, to bind to that iodine, to transfer that iodine to the thyroid gland where it can be utilized effectively. Here's a couple examples of a goiter. On the left, you can see that the goiter is pretty uniform from side to side. And on the right, you can see that the goiter is much more prevalent on the right side of this little girl's body. Here are some other pictures of unusual nodules and swelling that occurs in the thyroid gland. And in this case, these are goiters. On the left-hand side, you can see the woman who has the nodule mostly in the right side of her thyroid gland. And then on the right picture, the woman has the nodules that are pretty much on both sides of her thyroid gland. The great news is that when you give these people enough iodine, these goiters go away. Anytime you have a gland that is working really hard to do everything it can, it gets bigger. And so when you give those glands everything that they need to work, then they get back to normal size. And that is exactly what happens when you start taking enough iodine so that your thyroid gland can get back into normal working condition. You get rid of these nodules, you get rid of these enlargements, and your thyroid gland gets back into normal use. So now that you have an understanding of the different types of hypothyroidism, and now what's causing the majority of hypothyroidism, which is iodine deficiency, what should you look for if you think that you have a thyroid problem? So now we're going to look at some different physical indicators that can provide you with significant information to see if a thyroid condition is something that we need to address. These clues can guide you to the underlying causes of your thyroid condition. And you can use visual markers to observe improvement over time. And so another thing you can use is before and after pictures so that you can document the changes that would otherwise be missed. The first very common sign of a hypothyroid situation is dry, thin, and sparse hair. Another very common symptom that occurs when somebody is having a thyroid issue is excessive hair loss. Another very common sign that you will see with people who are having hypothyroidism is that you will lose the outer third of the eyebrow. Another very common sign of hypothyroidism is puffiness around the eyes or orbital puffiness. The entire face becomes very puffy, but you can really notice it in the eye sockets. And some people just don't get puffiness around the eyes. They get general facial puffiness. In other words, their entire face becomes puffy when they are suffering from hypothyroidism. Another place to look for signs of hypothyroidism is to look at the hands. When your skin is extremely dry, even when you use all kinds of lotions and potions to increase the amount of moisture in your skin, this could be a very good sign that you are dealing with a hypothyroidism. So the next sign you should look for is double lines on your neck. This is extremely common, and once you start noticing it, you will see it almost everywhere. And these lines will be parallel across the neck. In other words, it sort of looks like a necklace that is across the neck, but it is just a skin line. And this is often thought to be being caused when the normal creases or fat lines become puffy. These creases will connect in the middle and are continuous from left to right. And this indicates swelling within the thyroid gland. So here are some pictures of the double ring around the neck. As you can see on the right picture, one is high just below the chin, and one is low right at the base of the neck itself. And the puffiness that you see in the middle is actually where the thyroid gland is located. In this picture, you can almost see 3 rings, but the 2 rings, the one on the top of her neck and the one on the bottom of her neck, are extremely prominent. And in this picture, you could almost see 3 different rings again. Between the first and second ring from the top is where the Adam's apple is, and then you can almost visualize where the thyroid gland is between the middle line and the bottom line. That is exactly where the thyroid gland is located. So here is an example of what a post-treatment photo can look like. Of course, on the left-hand side, you can see how puffy everything is. She's still holding on to an awful lot of fluid in her entire face, but really the biggest thing is around her eyes. But in the photo on the right, you can see almost all of the puffiness is gone underneath her eyes. Her entire face is much less puffy, and she is doing better. So now let's talk about the second gland that is involved with stress handling, and that is called your adrenal glands. And with adrenal stress handling, the function of the adrenal gland is to increase the blood sugar with cortisol. Cortisol also aids in the metabolism of proteins, fats, and carbohydrates. The most common symptoms associated with problems with adrenal stress handling: you cannot tolerate stress very well, you get sleepiness after meals, you get dizziness from going from sitting to standing, you have extreme hunger in between meals, you eat whether you're hungry or not, and finally, you crave salt like crazy. So your adrenal glands are of the utmost importance when it comes to your ability to handle stress. It is the primary driver of your stress handling mechanism. So if you have an adrenal problem, you will also have a thyroid problem, and you will also have a gonad problem. If you're a man, that is a testes problem. If you're a woman, that is an ovary problem. So when you're talking about the hierarchy of the priority, think about your adrenals as number one, your thyroid as number two, and then your gonads, either your ovaries or your testes, as number three, when you're looking at your priority to handle your stress effectively. The adrenals, as the primary stress handling gland, has as its biggest weapon cortisol. And cortisol has many primary roles in taking care of stress in your body. Cortisol is extremely important in your overall stress handling mechanism. The first thing it does is it counteracts insulin. So if you have too much insulin being produced, you're going to produce more cortisol to balance that insulin. Cortisol also helps to stabilize your blood sugar, because as your blood sugar comes up, so does your cortisol come up. These two things help support healthy cardiovascular system function. Because if you have too much blood sugar or too much insulin, then you will cause too much inflammation and start to cause problems with your cardiovascular system. Another very important role of cortisol is to help keep your immune system in check. So when you are having an immune challenge, your cortisol levels can come up and help your immune system work correctly. But in times where you're not stressed, then cortisol comes down and your immune system gets a rest. And so that is really important, so that then your immune system just doesn't run amok and start causing an autoimmune disorder. Cortisol also aids in protein, fat, and carbohydrate metabolism. So cortisol also helps you digest your food. It stimulates glucose release from your liver, and it also promotes mobilization of fatty acids from fat tissue. So cortisol is necessary and a primary driver of all of these different things that are part of your stress handling mechanism. And here are some other primary roles of cortisol. As you could tell, cortisol is the main stress handling hormone that we have, and it is produced by the adrenal glands. So if your adrenal glands become fatigued, then your cortisol levels become fatigued and can cause all kinds of problems. Another primary role of cortisol is to regulate your arterial wall contraction. In other words, when you are under stress, your arterial walls are going to be contracted and allow you to have higher blood pressure, to get more blood to your organs, glands, and tissues so that you can fight that stress. But if you have low cortisol, this will equal low blood pressure. And so many people, when they become fatigued and their adrenal gland becomes fatigued, they start having problems with low blood pressure, not high blood pressure. Another role of cortisol is to regulate serum or blood sodium and potassium levels. This is also important in your stress handling mechanism, because so many people are having trouble with their sodium and potassium in their blood, but this is secondary to the amount of cortisol that they have. When their cortisol levels start to drop, so will the sodium and potassium levels, and this leads to high blood pressure. Another role that cortisol has is it helps to increase the glycogen production inside the liver. Glycogen is two sugar molecules bound together. And when your blood sugar starts to drop under stress, the liver starts to increase glycogen production, and it's being stimulated by cortisol production. So when you don't have enough cortisol, then you cannot keep your blood sugar more stable, which in turn allows your liver not to produce enough glycogen, and so then your ability to handle stress becomes compromised even further. Another important role of cortisol is to help you store favorable short-term memories. Cortisol also has a very strong effect on your brain, especially on the middle part of your brain that controls where short-term memories are stored. So when you are having trouble with your memory, it is because you are also having trouble with your cortisol. Cortisol is also important with healthy bone metabolism. So if your cortisol level is not very good, then your ability to create healthy bone and maintain healthy bone is also not very good. Another really important primary role of cortisol to bring up again is it helps to maintain a healthy thyroid gland. You cannot have a healthy thyroid gland without a healthy adrenal gland. They go hand in hand with each other, and there is no way to separate these two glands because they are so intertwined. The final primary role of cortisol is it helps to stimulate normal gastric secretions. So at times of high stress, you are going to decrease the amount of acid you produce because you don't need stomach acid or digestion when you're trying to run from a bear. But as cortisol levels drop, then the amount of stomach acid secretion comes up because you're going to need to replenish all of that energy that you have just expended getting rid of that stress. So cortisol is necessary for all of these different things, and so the adrenal glands are the major producers of cortisol, so that is why they are so important. So here is a diagram that can show you how cortisol is produced by the adrenal gland. Cholesterol goes to what's called pregnenolone, and then pregnenolone turns into progesterone, and then progesterone turns into other hormones, but then gets turned into cortisol. But as you can see, as you're moving from left to right, there is many other hormones that are produced in the adrenal gland. And the biggest ones, of course, are all the way on the right, which are your testosterones. And your testosterones can also turn into estrogen and something that is called DHT. And so cholesterol is the precursor to every one of your adrenal hormones and every one of your stress, sex, and anti-inflammatory hormones. So if you don't have enough cholesterol, you cannot produce and create cortisol, testosterone, or estrogen. So here is an example of why there is so much people talking about getting their cholesterol numbers down, but it is really not the best way to go about things, because if you don't have enough cholesterol, you can't produce enough cortisol, and you can't produce enough sex hormones. This diagram represents what's called the pregnenolone steal. And when you are under high levels of stress, the adrenal glands will take the cholesterol and produce pregnenolone. And that stress pulls everything to the direction of cortisol. And so when you are under high levels of stress, pregnenolone will produce more progesterone, which will produce more cortisol. And so that progesterone then is stolen away from the other side of the adrenal hormone pathway, and so it cannot create DHEA or testosterone or estrogen, because all of that cholesterol is being pulled to the side of stress and not to the side of sex hormone production. So now that you understand how your liver works to handle stress and how your thyroid gland works to handle stress and your adrenal gland works to handle stress, if you're a woman, let's talk about how your ovary helps you handle stress. So, of course, your ovaries produce your reproductive hormones, but also produce stress regulating hormones. When your ovary stress handling mechanism is not working well, the top symptoms that you will see will be a decreased libido or sex drive. You will have reduced sexual function. In other words, you might have dryness or you might have other problems when you are having sex. You will also have infertility issues. You'll have a decrease in the amount of bone mass, and that is due to the amount of decrease in estrogen or the imbalance between estrogen and progesterone. And finally, you will have poor energy production because your ability to handle that stress is going to be decreased dramatically. There's also many other common ovarian symptoms. One of the most common is when you have testosterone dominance. In other words, you have too much male hormone as opposed to female hormone. This can lead to atrophy or shrinkage of the breasts, deepening of the voice, so the voice becomes more masculine, and facial hair can also be observed. Another common ovarian symptom when signaling from the pituitary, ovaries, and adrenals become weak is night sweats. So when your ability to signal your ovaries from your pituitary gland and your adrenal gland get poor and become less, then you increase the amount of night sweats that you have. And probably the most common ovarian symptom is the painful cramps, heavy bleeding, premenstrual syndrome, the cravings and the feelings of depression and or despair that may occur during the menstrual cycle. So as we've talked about earlier, the adrenal glands are the backup system for not only the female sex hormones, but also all of the sex, stress, and anti-inflammatory hormones. And when your female hormone production decreases in menopause, then the adrenal gland has to be the backup mechanism for those female sex hormones. So if you have trouble with your adrenal glands, the symptoms will be significantly increased when your adrenal glands are weak and you're going into menopause. This also occurs in men. So when your adrenal glands are weak and men are starting to downregulate or not produce as much male hormones as they used to, this can actually cause male menopause. So this brings me to the final stress handling hormone that are in men. And the men's hormone is called testosterone. And it is produced in the testes. And this is the way that the testes handle stress. And so it is no coincidence that when a man starts to have problems with their testosterone, they will get saddlebags and a front pouch of fat below their belly button. It has also been proven that when you produce a hormone called DHT, that it will actually increase the amount of male pattern baldness that you have. So as you continue to handle stress and that stress becomes just too much for you and you start to have trouble handling it, when your adrenals start to fatigue, then your testosterone starts to fatigue, and it leads to all of these different problems that men are facing in greater numbers all the time. The most common testosterone symptoms are balding around the crown of the head in men, male breasts, and erectile dysfunction. So when you start to decrease the amount of testosterone that is being produced because the adrenals become fatigued, these are the three most common symptoms that you will see. Other common testes kinds of symptoms include hair loss. This is caused by poor conversion of testosterone to DHT, because testosterone is supposed to be converted to DHT in some degree, but if there is too much conversion, then you'll start losing hair, especially on the top of your head. Another common testes symptom is when men develop breasts when the hormone production is stressed and imbalanced. And this commonly occurs because of what's called estrogen dominance. When men have too much estrogen compared to the amount of testosterone, they will actually start to have breast tissue similar to women. And so when that occurs, what has to happen is you have to increase the adrenal health. So when the increase in the adrenal health occurs, then there is more of the adrenal hormones that are pushed towards testosterone and less to estrogen. The final common testes symptom that you might see is poor liver clearance and imbalanced estrogen hormones cause little red dots to occur, especially on your belly. So if you're starting to see these little red dots pop up on your belly and you don't know, or on your skin and other places, and you don't know where that is coming from, that could very easily be part of a hormone imbalance between your estrogen and testosterone. So what do you really need to know about step 8? Step 8 is really all about healing your glands and organs by slowing down the aging process and promoting healing. You have one organ and 3 glands to slow down aging and promote the healing process. These include your liver, your thyroid, your adrenal glands, and your ovaries or your testes, depending if you're a man or a woman. And your future health depends on how well this one organ and these 3 glands work. You now have the power to heal them all, so let's get busy.